Hi, my name is Ivy.
And my name is Chris.
Together we are going to tell you all about hantaviruses. So what is a hantavirus? A hantavirus is a deadly virus carried by rodents. Specifically, it is carried by the cotton rat, deer mouse, rice rat, and white-footed mouse. Note the hantavirus is not deadly to mice, but it can cause a very intense and severe disease called Hantavirus Pulmonary Syndrome in humans. The rodents who carry hantavirus are found in areas where people enjoy outdoor activities. And approximately 14% of the nation's rodents carry the virus.
The history of hantavirus starts with the Korean War. From 1950 to 1953, soldiers fighting in the Korean War were observed to get sick with fever, pain, nausea, chills, and blurred vision. Because the soldiers ended up getting their kidneys damaged near the end of the sickness, it was called hemorrhagic fever with renal syndrome, HFRS. Since hantaviruses are so small, they were not discovered until 1978, when scientists investigated infected field mice. This was the first time people could see the virus that caused the Korean War sickness. A year later in 1979, hospitals first started to use technology to identify the virus in patients that were sick with HFRS. During the 1980s, different types of hantaviruses were discovered in Asia and Europe. Then in 1993, a type of hantavirus called cynomolgus sickened people in the Four Corners region where Arizona, New Mexico, Colorado, and Utah meet.
This leaves us in the present day, in which hantavirus is still a relatively uncommon, but existent threat, with the January 2017 outbreak in various U.S. states. Check out the 4 darkest states on the map where it all started.
Hantavirus is not just found in the US, it is found in the entire world. Different strains can be found in different countries, and each country has its own incidence for the virus. The incidence, which reflects how commonly encountered the virus is in a given region, is highest in Asia, with the highest incidence in China followed by Russia. The United States, Brazil, Argentina, and Chile in the Western Hemisphere follow. The virus is also found across Europe with the highest incidence in Finland, Sweden, and Germany. Perhaps surprisingly, no hantavirus has yet been found in Great Britain.
So why has hantavirus emerged to become an up-and-coming infectious disease? Well, it seems that the increase in hantavirus infections is related to changes in the movement and population size of its rodent vectors. We can divide these changes into 2 groups: man-made and natural changes. Man-made changes include things like dams and water flow modifications in the environment, deforestation and reforestation, and the unintended transportation of the vectors on ships to new areas of the world. Natural changes can include floods and droughts, famines, and natural climate changes in the area. Both of these types of changes can affect the overall rodent population, both in terms of their numbers as well as how frequently they cross paths with humans. Changes that increase either or both of these have contributed to an increase in the amount of hantavirus exposures and subsequent infections that occur. When there is more rain, there is more food for mice to eat, leading to more mice. With more mice comes an increased chance of the hantavirus, which is spread through mice feces and saliva. Be careful how you clean up the feces from mice. Hantavirus can be stirred up into the air by sweeping up mice feces, leading to human transmission. Now, let's talk about the vector of transmission for hantavirus. Hantavirus is carried and spread by certain rodent species, through their saliva, urine, and excretions. In the United States there are 4 rats and mice that transmit hantavirus. First, the cotton rat is found in the southeast and central South United States. Second, the deer mouse is found across most of the continental United States. Third, the rice rat, which is found in the southeast United States. And last but not least, the white-footed mouse, which is found in the eastern and central United States.
When the rodent excretions are disturbed by human activities, like stepping on a nest, this causes the viral particles to become airborne so that people can inhale the virus and become infected. Scientists suspect that an infected rodent can remain a positive vector for hantavirus for the rest of its life, and it's known that seasonal infections peak during the spring and fall, likely as a result of farming cycles and rodent population booms.
Okay, so I have a question from the audience. You have been telling us all about the rats and mice that can transmit hantavirus, but what about the important part for humans? What are the symptoms of Hantavirus Pulmonary Syndrome? How do I know that I don't have it and am not sick right now?
Hey, that is a great question. I'm glad you asked. Early symptoms include fatigue, fever, and muscle pain.
There may also be headaches, dizziness, chills, and abdominal problems, such as nausea, vomiting, diarrhea, and abdominal pain.
Late symptoms include coughing and shortness of breath caused by the lungs filling with fluid. So as their teacher and a scientist, I am going to jump into this presentation for 1 minute to focus on the biology behind the symptoms. And then we can go back to having fun, I promise. When you inhale the hantavirus, it travels to your lungs where it can enter the endothelial cells by binding to B2-integrin proteins. The B2-integrin proteins usually play a role in cell-to-cell adhesion, but the virus can take advantage of their presence on the cell surface to enter the cell and replicate. But wait, the hantavirus infection alone does not kill these endothelial cells. The immune system responds in 2 ways. First, to bring immune cells to the site of infection, the capillaries, which are blood vessels in between your arteries and veins, become leaky, allowing immune cells and proteins to escape into the surrounding extracellular fluid. And second, in response to the interleukin-15 stress signals that are sent out by the infected cells, special immune cells called natural killer cells become activated. Now, natural killer cells are designed to recognize and remove virus-infected cells by producing enzymes called granzymes that kill infected host cells by degrading their proteins. Unfortunately, here we have a problem. The virus's NP protein interferes with the natural killer ability to kill virally infected cells by inhibiting the activity of granzyme.
Oh no!
As a result, the natural killer cells that are activated by the hantavirus are unable to kill the virus-infected cells and are more efficient at killing uninfected cells.
So what happens to the lungs?
The lungs undergo acute respiratory distress syndrome.
What do you mean?
The natural killer cell activity combined with swelling, which is medically called edema, caused by fluid flow from the leaky capillaries into the pleura and lungs or other organs, leads to hemorrhage and necrosis, death of the lung tissue. The dying cells are inefficient at transporting oxygen, and so the patient enters a state of hypoxia that can then lead to shock.
Thank you for that, Professor. But I have to admit, the symptoms that you described earlier sound kind of scary. Could you please tell us about the available treatments for the disease?
Of course. Unfortunately, there are not quick and specific treatments for this virus. However, if you are feeling deep muscle aches, different than from working out, shortness of breath, even when sitting down or doing things that don't take a lot of energy, and have a fever, please talk to an adult and get to a doctor ASAP. The sooner you go, the sooner you can start feeling better. It's always better to be safe than sorry, so don't try and downplay anything that you might be feeling that's different than normal.
If you end up getting the virus, you might spend some time in the intensive care unit. The doctors will do their best to take care of you, so be brave and don't be too scared. If the virus progresses quickly and gets very bad, you might be put on a mechanical ventilator. This is a machine that can help you breathe when your shortness of breath is too much to handle. Some drugs that might change how your heart beats might also be given to you. A catheter might have to be administered so you don't have to worry about going to the bathroom as you get better. Plus, there are some ways that you can prevent contracting the virus though. Please take notes and remember these key facts. Small rodents, such as mice and rats, may carry the disease. If you see these little critters running out and about, stay away from them. Do not touch them, pick them up, or try and get them to get close to you. They may seem normal, but there is a chance that specific rodents like the deer mouse and the cotton rat may be carrying the virus.
Also, keep your campsite clean. This is very important as these little guys love clutter to build their nests and little houses with. Try to keep wood for campfires in an organized manner. Food should be kept in airtight containers, such as plastic and glass. Coolers should also be made of thick plastic, not styrofoam or anything flimsy, so that animals cannot bite through it. Keep garbage and trash away from the campsite and sleeping areas. Try to find trash cans with lids on them so the rodents cannot go through the garbage.
Last but not least, try and keep your sleeping areas as secure as possible. This means that when you are going in and out of your tent, try and close/zipper the tent flaps so that nothing small, like a mouse or rat, can get inside. Don't sleep on the bare ground and try to keep at least one layer between you and the ground. Always check your area, whether you are sitting, sleeping, or just hanging out to make sure you don't accidentally step on a nest of a rogue rodent.
Just a shout out from a park ranger here in the audience. Yosemite National Park took multiple actions to respond to the hantavirus. One of these is increased routine measures to reduce the risk of hantavirus. For example, regular inspections and cleaning of rooms and cabins, exclusion of deer, mice and other rodents from buildings. The park provided education materials to all overnight guests. The park also made brochures on the virus available at campgrounds. The park has been working with the California Department of Public Health and Yosemite National Park Public Health Service officers to do rodent surveys to monitor deer mouse abundance and virus activity in mouse populations. If you have any questions on the virus, call 209-372-0822. Thank you.
And thank you everyone for listening to our presentation today. We truly hope you enjoyed it.
Bye.
Bye.